Friends, I am Dr. Suresh Singh from Impal, Manipur, a retired Director of Health Services, Manipur, and a public health doctor. I would like to elaborate points submitted to our Honorable PM in my 5 letters submitted to him. These are the proofs of those letters. One can see it. Now, let me come to the present hot topic in India, that is lockdown, treatment, etc. of the coronavirus infection. What I have written to our Honorable PM is that we should stick to the basic principle of control of the communicable disease as done in leprosy program, malaria program, and other national health programs. That means basic idea is first to detect the positive cases by house-to-house surveys and the laboratory testing. Second, by treating, and the third, by other preventive measures. So let me come from upside down. In the preventive measure, the best thing is the present lockout. That means shutdown throughout India as done by our Honorable PM. This is a master stroke from our PM. But the question is, how long it will take? In principle, this is based on incubation period. That is the period where the germ or virus enters the body and the appearance of the symptoms to a patient. So that is universal accepted form is 2 to 14 days. So this lockout or shutdown should be a period of 2 weeks maximum. That is all. We need not require further shutdown in India. In fact, to me, this 21 days or 3 weeks shutdown is even 1 week more than what is required as a public health man. So my basic point is it should be stick to 14 days period. Another point now coming to the hot topic, that is up to yesterday, PM has interacted with various CMs, etc., is that whether this will continue or not. My basic point is, as a public health man, is that it should not be continued. India does not require this continuous shutdown at all. This should be stuck to the areas where there is positive cases. That means we should identify red areas, red spots, stick to them, do the house-to-house survey as I mentioned earlier, do the laboratory testing, find out the new cases, then isolate those red spots for another 2 weeks, that is 14 days. So we cannot, for the entire India, we need not do this total shutdown. Of course, shutdown can be lifted in a phased manner, that is there, that's okay. To some modification here and there, that's okay, up to the government as per the decision of the PM. But my basic point is, this whole India does not require this total shutdown. This is one. The second other point is that treatment will be there. Once it is positive, it will be treated in the hospital, that is okay. But other preventive measures like using of mask, hand washing, 6 feet apart, then other hygienic conditions should be continued as per the director of the government. It is fine, very nice. But regarding the use of masks, I am the first doctor to communicate to the PM on 22nd, starting from 22nd March. That means it should be used by all, wherever is available, everywhere. So basic idea is, it is a two-way traffic. One, I prevent the spread of the disease, not only corona, but other infectious diseases to the other person. Plus, from the other person, it prevents the spread to me, to self. So this is a two-way traffic. I don't know why our ICMR people or renowned ICMR scientists are not communicating this. Only Prime Minister has agreed to accept it on 3rd April this month. Another point is, I would like to mention is the use of chloroquine. I am also the first person to advocate this preventive use of chloroquine for the medical professional, for the contact new positive cases, as well as contact family and other primary and secondary contacts. Basic idea being, this chloroquine is used as a preventive measure in malaria control program. We have used it extensively and lots of people have used it. So once it is proved that chloroquine is effective in the treatment of COVID-19 infection, then the use of this one is very much advocated. But however, ICMR has recommended is on 23rd March or so to use it in a limited scale. But I would like to use it in all medical staff, positive cases, their contacts, their families. So, in brief, this is the one I would like to advocate or to request our Honorable PM. Again, I emphasize that there is no need for total shutdown of India. This should be limited to the particular places, to the red spot, red zones, where there should be total complete shutdown in that particular area, except of course essential items, the essential systems. And we should monitor it thoroughly. This virus is going to stay longer in India, but to a limited state in sporadic forms. So we should be prepared to fight it thoroughly. We should be prepared for that in a calm manner. Prime Minister is calm, I hope. He is using every means, but still I would like to put this case, these suggestions forward to him. Thanks.